Hello and welcome to the program. I'm your host, Neal Howard, on this Health Suppliers segment here on Health Professional Radio. Depression is one of the most misunderstood and debilitating of mental conditions, the symptoms ranging from, mild to severe, with potentially very, very dangerous effects on sufferers. Our guest in studio today is Dr. Aron Tendler, Chief Medical Officer at Brainsway, and he's here to discuss Brainsway's Deep TMS. How are you this afternoon, and welcome to Health Professional Radio, Dr. Tendler.
I'm doing well, thank you.
Thank you. What exactly is Brainsway? Talk a bit about your background and how you fit in with Brainsway.
My background is I'm a board-certified psychiatrist, and I finished my training in 2006. I was in private practice and doing some clinical research with patients with treatment-resistant depression, doing some interventional approaches in treating people that failed treatments with medications. And after doing that for several years, I joined the company as their chief medical officer. Brainsway is a manufacturer and patent holder and inventor for a technology called Deep Transcranial Magnetic Stimulation. They make a device, several devices, but they make one FDA-cleared device that emits magnetic pulses to specific areas in the brain that are affected in people that have depression. And by targeting those areas, we're able to hopefully renormalize them, but effectively treat patients who have not benefited from medications to treat their depression.
Now, the symptoms of depression range, as I said, from mild to severe. Are there ever instances when someone is diagnosed as having a mild to moderate form of depression that is still resistant, or is this resistant depression always a severe form?
So depression is a chronic illness for most people that get it, a chronic recurring illness for most people that get it. In fact, about 17% of Americans will get depression in their lifetime. And for most of those people, it'll be something that they'll get and then probably get again and then probably get again and then probably get again. And for some people, it'll be chronic. And the reason why I'm bringing that up is because at various points in time, it'll vary in its severity. So at some point in time, the person may have a severe depression in which they may have thoughts or even attempts to end their life, or thoughts that they'd rather be dead, and inability to function at work. And sometimes it may be mild, where they're just not getting the pleasure out of things, but they're essentially functioning normally, and other times it may be moderate. But the bottom line is that when depression is treatment resistant, meaning it's not responding to one or more medications, typically 2 medications is what we typically call treatment-resistant depression. Mm-hmm. It typically is going to have a patient who has that is typically going to have a relapse. In fact, the frequency or how soon the relapse is going to come on actually can be predicted by the number of residual symptoms the person has. So if I treat a patient for depression, and depression has 9 symptoms, and if you have 5 out of the 9 symptoms, you're considered to have what we consider a major depressive episode. But let's say I treat the person and they're better, but they still have difficulty with concentration and they still have some difficulty with sleep. But they don't have, they're getting pleasure out of activities, and their appetite's normal, and they're not crying, and they don't have thoughts of death, and they don't have guilt, they don't have feelings of worthlessness, but they still have those 2 symptoms. They're more likely to have a relapse within 6 months versus someone who has no symptoms.
How does Brainsway educate the patient on, say, the advantages or maybe some of the disadvantages that may be associated with this newly FDA-approved non-traditional treatment for major depression?
So for people that have depression, whatever the cause of the depression, so the depression, as I mentioned, people would have at least 5 out of the 9 symptoms. Mm-hmm. So, sadness and cheerfulness, or lack of pleasure, and changes in their energy and motivation. And whether that came after some sort of problems with a relationship or a job, or or some sort of a trauma. But if someone has those symptoms and they last for more than 2 weeks, and again, whether there was some event that initiated it or didn't initiate it, if they have a major depression, the changes that occur in the brain are all the same. The brain doesn't really distinguish between those two. And the treatments that we have for depression, they fall into several categories. They fall into categories of medications. They fall into a category of psychotherapy. And they fall into categories of brain stimulation treatments, non-pharmacologic brain stimulation treatments. And treatment-resistant depression means that the patient has failed one or more, typically considered two, but one or more medications. And I mentioned earlier that about 1 in 6, about 17% or so of Americans will have depression in their lifetime, and 52% of them will fail one medication, and 32% of those people will fail 4 medications.
Wow.
So medications are considered to be, the normal course of treatment for depression. But out of those, 15 million Americans, for example, out of those 16% of Americans, we're talking about 32% of them are not getting better from the medications that we give them, and those are antidepressants. So as far as treatment-resistant depression, which could be anywhere from 52 failing one medication to 32 failing any medication, you can give them medications that are not typically considered antidepressants, such as antipsychotics. If you add an antipsychotic to an antidepressant, that's one technique. Other things people do work. Psychotherapy helps. It doesn't help more than medications do, but sometimes combining psychotherapy with medication can help some people. And the other approach is brain stimulation. And what's available out there as far as brain stimulation, the gold standard for treatment-resistant depression is something called electroconvulsive therapy. Electroconvulsive therapy, also known as shock therapy or ECT, that has the best treatment efficacy for people who have treatment-resistant depression. Now, there are some disadvantages to the various treatments. So, for example, adding an antipsychotic to the antidepressants. Well, the disadvantage is that there's usually, significant side effects to those medications. Usually weight gain is what I'm thinking about.
Mm-hmm.
Sometimes diabetes, but primarily that's a disadvantage going on to that medication. That doesn't mean it's not a good approach to try. Psychotherapy, it doesn't have tremendously high rates of people getting better. It's not been considered a gold standard kind of treatment for people who have treatment-resistant depression. But it's something you typically try in people who failed medication or even people who haven't tried medication yet. As far as electroconvulsive therapy, which is the gold standard treatment, most people don't want to try that unless it's really the last line of treatment because it has a lot of cognitive side effects. People have a lot of memory loss and they can't drive for 6 weeks around the treatment. So you have to be driven to treatment and back. And every time you go, you have to undergo anesthesia, and then you're given a seizure, and then someone takes you back home. So it's not the normal course of treatment. That's where transcranial magnetic stimulation comes in. You go to the treatment, and you go specifically into the doctor's office. The doctor has a machine, and specifically with deep transcranial magnetic stimulation, which is what Brainsway provides, you're basically sitting on a chair, and a helmet is placed on your head, and you feel a tapping sensation for 20 minutes. Mm-hmm. And the side effect that's most common is a temporary headache during the treatment. And the rare side effect that's risky is people get there's a rare incidence of getting a seizure during the treatment. Similar to the risk of getting a seizure, for example, if you're taking an antipsychotic or if you're taking some medication combinations. So it's pretty rare, but it doesn't cause any cognitive side effects, no memory loss. And you drive yourself to the doctor and you drive home, and you do it 5 days a week, typically for somewhere between 4 and 6 weeks. You may need some more treatments after that. And you're actually have no weight gain, no sexual side effects, no diabetes, no cholesterol. You could do it being on any medications. And the only contraindication, the only thing that you can't, that prevents you from getting this treatment is if you have any magnetic material in the skull. So if someone for some reason had surgery that put some magnetic material in the head, and you can't get, for example, an MRI of the brain, you also can't get this transcranial magnetic stimulation treatment for depression.
So some of the side effects are similar to what you call shock treatments, but they're very rare. Is this low level electricity? Is there any electricity involved at all?
So it's an excellent question. So with shock therapy, you provide actual direct electricity to the skin and the scalp and thus to the actual brain, and you induce a seizure. Mm-hmm. So the way shock therapy works is you cause the patient to have at least a 30-second seizure every time they come in, and you do shock therapy, 3 times a week, typically for 12 to 16 treatments. That's how shock therapy works. So you're giving the patient a seizure 3 times a week. And in shock therapy, because you don't want the person to shake and bang their hands and injure themselves, you put them you give them anesthesia and you paralyze them. So it's actually it looks pretty pleasant, and it doesn't look like the person's having a seizure. It just looks like they're asleep and they're getting some sort of minor twitch. You don't see any of that. But because you're giving them a seizure, it causes cognitive side effects. It causes some memory loss, and people don't remember anything around that period of time, and they're not supposed to sign any contracts, and they can't drive for about 6 weeks because you're giving them frequent seizures. With transcranial magnetic stimulation, we're not applying direct electricity to the skull or the skin, so there's no discomfort there. What we're doing is we're inducing an electric activity in the neurons by applying magnetic pulses. And magnetic pulses, using Faraday's law, can induce a current in a conductor, which are neurons. So we're inducing a focal current in a small area of the brain, without inducing a generalized seizure. But what can happen in rare cases is it can generalize and the person can get a seizure, which is what I mentioned. There is a rare risk of a seizure, not common. And the side effects are not the same. That's why there's no cognitive side effects with transcranial magnetic stimulation. You don't have memory loss with transcranial magnetic stimulation. You drive yourself there and back, etc.
So, and in answer to my question, there is electricity involved, but it's the brain's own electrical currents that are stimulated into firing, not anything outside that's being introduced into the brain via the skin.
So we're not applying. Yes, we are inducing a current. We're inducing electricity in the brain, in a focal area in the brain, as opposed by applying magnetic pulses. We are not applying direct electricity. So we are. I guess the best way to think about it is we are applying focal electricity to a small area of the brain, as opposed to causing generalized electrical activity in the whole brain, which is what ECT does.
That's quite a bit of information, especially to someone who may be suffering from the very depression that you're treating. How does Brainsway reconcile the lack of knowledge of the patient as to all of these options and side effects or lack thereof in order to better help the patient? Do you have a staff that is dedicated to educating the patient, or is the practitioner solely responsible for each patient?
So, in reality, what we do is we have someone who answers questions, but we really train the people who get our devices, which are the practitioners, and we try to provide them with very specific literature to educate their patients, because it's very important that when a patient comes, that they be provided with all of their options. That's part of getting an informed consent. And the way, it's whenever a patient undergoes any procedure or any treatment, they have to be aware of what else is out there. And that's part of the practitioner who offers the treatment. It's part of their job as a physician to present the information in a clear way that makes sense, and a not confusing way, and in a way that convinces the patient of what the practitioner thinks is logical, not confusing.
Now, this has been recently approved by the FDA. Am I correct in that assumption? Maybe recently in the last 2 years or so?
So it was approved in January of 2013, just over, like 2.5 years ago. And it's been very well accepted. There are about 140, I'm not 100% sure exactly, but on our website you can see, on Brainsway.com, you can find a provider. So there are about 140 locations in the United States that provide it. And basically, patients can also go to the website and they can see more information and videos showing interviews of patients, or showing the device and what it's like, and there's some information on there as well, and publications, etc.
Thank you so much for joining us here on the program today. You've been listening to Health Professional Radio. I'm your host, Neal Howard, for this Health Suppliers segment. Our guest has been Dr. Aron Tendler, Chief Medical Officer at Brainsway, talking about Brainsway's Deep TMS, or Transcranial Magnetic Stimulation therapy. We've been talking about what TMS is, when it's considered as a treatment option, and also directed our listeners to a website where you can get more information about TMS and Brainsway. It's been a pleasure speaking with you this afternoon, Dr. Tendler.
Thank you, Neal.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.